Hello, mortals. I am Dr. Sombrio, and today we will talk about something that will make you rethink the fragility of the human body. Imagine waking up one day and realizing that your own body is rotting alive. In 2019, a 35-year-old man arrived at the hospital with a small wound on his foot. In just 6 hours, that wound had spread up to his knee, and in 12 hours, the doctors had to amputate his entire leg to save his life. What caused this? Necrotizing fasciitis, also known as a flesh-eating disease. But what exactly happens in your body when you contract this deadly syndrome? Necrotizing fasciitis is not caused by a single villain, but by a gang of killer bacteria, the most common being Streptococcus pyogenes, Staphylococcus aureus, Clostridium perfringens, and Vibrio vulnificus. These bacteria do not just attack the skin. They're like microscopic serial killers that destroy the deeper tissues, muscles, fascia, and subcutaneous fat, literally eating you from the inside. The term necrotizing comes from the Greek nekros, which means death, and that's exactly what happens, massive cell death while you are still alive. But why is this infection so devastatingly fast? The answer lies in the bacteria's diabolical strategy. First, they produce enzymes called collagenases and hyaluronidases. Think of them as molecular acids that dissolve the connective tissue that holds their cells together. Second, they release toxins that destroy the local blood vessels. Without circulation, the tissue dies quickly. It's like cutting off the oxygen supply to an entire city. Third, and more frightening, they spread to the fasciae, those tissue highways that connect different parts of the body, which is why the infection can travel 2 to 3 centimeters per hour. The first symptoms are deceptively simple. In the first 24 hours, you feel intense pain disproportionate to injury, redness and swelling, high fever, and skin that is hot to the touch. But here's the nightmare. Within a matter of hours, the situation becomes critical. Between 24 and 72 hours, blisters filled with dark fluid appear. The skin takes on a bluish-grayish color. There's a loss of sensitivity because the nerve is dying and the patient goes into septic shock. In the final stage, the tissue turns completely black. Total necrosis. At this point, only immediate amputation can save the person's life. Now, the question that all of you are asking, how does someone contract this curse? The main entry points are open wounds, even small ones, surgeries, insect bites, burns, and the use of injectable drugs. People with compromised immune systems, diabetics, alcoholics, and the elderly are at much higher risk. But be aware, healthy people can also be victims. To prevent it, it is essential to clean any wound well. Seek medical attention if the pain is disproportionate, not ignore signs of infection, and keep diabetes under control. The numbers are terrifying. The mortality rate is 25 to 35%. The spread rate is 2 to 3 centimeters per hour. There are between 700 and 1,200 annual cases in the United States, and the critical treatment time is only 6 to 8 hours, meaning every minute literally counts between life and death. Remember, mortals, the human body is simultaneously an incredible machine and terrifyingly fragile. A small wound can become a death sentence in a matter of hours. If this video made you question mortality, leave a like to feed the algorithm's darkness. And if you want more dark knowledge about the mysteries of medicine, subscribe to the channel. Until the next consultation, if you survive,